Good morning, teachers and students. My name is Yao Si Chong, and today I'm going to do a case study presentation on a disease, which is the polycythemia rubra vera. And this is the overview of my case study presentation, which includes some basic information about this disease, included the epidemiology, the etiology, the simple signs and symptoms include some clinical features, and the investigations used in this disease, and the case study patient about his background information, the timeline, like what investigation she have taken, and also the result, and the blood investigation, the result of bone marrow study, the results of CT and ultrasonography, and the treatment she received. And at the last, I will suggest some other treatment modalities about this PRV disease. So, the polycythemia rubra vera is a myeloproliferative disease, which means it has excessive red blood cells are produced as a result of an abnormality of the bone marrow. So, as a result, it increase in all cells with marked increase in the red blood cells in the blood packed volume. And this is the epidemiology of the polycythemia rubra vera. So it occurs in all age group. The incidence will increase with age, and the median age is 60 years old of having this disease. And the male are more common of having this disease than the female. The highest incidence age group is 70 to 79 years old, which indicate the elderly are more common in having this disease than the younger ages. The etiology of this disease is associated with JAK2, which is the genus kinase2 gene, the mutation in up to 90% of all the cases. The JAK2 mutation renders the hemopoietic cells more sensitive to growth factors, such as the erythropoietin, so there are more red blood cells produced in the bone marrow. The signs and symptoms include the hepatomegaly, which is the enlarged liver, the splenomegaly, which is the enlarged spleen, which are some signs and symptoms that are easily to be diagnosed by doing the CT or MRI because they are easily to be observed. The signs and symptoms related to blood include the persistent elevation of the hematocrit and the red blood cell volume, the red cell mass elevation, the hemoglobin elevation, the oxygen saturation with the arterial blood gas, and the serum erythropoietin levels. And there are some clinical features as the signs and symptoms that can easily be observed, include the gout, which can cause pain in the leg, and the clotting, the bleeding, and also higher blood pressure than the normal. Some investigations can be done on analyzing this disease include the complete blood picture, the bone marrow examination, the computed tomography, and doing the ultrasound. So let's discuss about my case study. So this is the background information about my patient. She is a female with 73 years old, so she is elderly, which indicates she has a higher risk of having this PRV disease. As mentioned, elderly are more sensitive and more likely to have this disease compared to the younger ages. She was hypertensive, dyslipidemic, and non-diabetic, and she had vertigo, uncontrolled blood pressure, intermittent weakness of right lower limb for 2 days already. So she go to consult the doctor, and which found out that she has no other positive findings like hepato or splenomegaly or weakness of any part of the body were present. Okay, and this is the timeline of my patient from the diagnosis to treatment. She found out she has some symptoms like vertigo, uncontrolled blood pressure, and intermittent weakness of right lower limb for 2 days, and then she went to the doctor and asked for consultation. The doctor suggests that she need to do the physical examination, and the results showed that everything was normal other than having these symptoms. However, this is abnormal, so the doctor also suggests that she need to do the blood investigation afterward. And then after the blood investigation, the results show that it is abnormal at all. So she then transferred to do the bone marrow study, and then she transferred to do the CT and ultrasonography for further analysis. Afterwards, she has diagnosed it with early PRV, and then she then received the treatment to treat the disease. After the physical examination, a provisional diagnosis of polycythemia rubra vera was made and the blood was sent for investigation. The results of the blood investigation showed she had a higher hemoglobin level, which is 17.5, and the red cell count is 8.91 million, which is higher than the normal as well. The red blood cell level also showed some abnormality. The bilirubin level was upper limit of normal, and the uric acid level was 10.1, which is also higher than the normal level as well. The PBF, peripheral blood film, also showed some abnormality of the patient, which showed erythrocytosis, the thrombocytosis with microcytic hypochromic blood picture, and the leukocytosis. The high blood level of hemoglobin and the packed cell volume and the raised platelet count with leukocytosis aroused the suspicion of polycythemia rubra vera. Taking all the above parameters into account and in consultation with a hematologist, she had undergone bone marrow study. The results of the bone marrow study found out that she had hypercellular marrow with increased myeloid versus erythroid ratio. The erythropoiesis hyperactive and the micronormoblastic. The granulopoiesis also showed hyperactive and maturing into segment form with few myelocytes. The megakaryocytes also increased in number and showed this megakaryopoiesis. After those investigations about the polycythemia rubra vera, the patient was then suggested to do the image acquisition. She then did the non-contrast CT of the brain, which revealed the consistent with left cerebral infarct and the right matter ischemic changes. The ultrasonography of the whole abdomen showed normal in her case. So at the end, the patient was diagnosed with early polycythemia rubra vera, and she was treated with injection of the phlebotomy twice at an interval of 7 days. The tape hydroxyurea 500 mg per day, the tape icosapent 75 mg per day, the tape isloric, the beta blocker, the ACE1 and the calcium channel blocker, and the proton pump inhibitor. And this picture showed the injection of phlebotomy onto the patient arm. Since the treatment are majority internally, like injection of the medicine and intaking the medicine, so there are less side effects on superficially. The side effects include some common side effects of diarrhea, nausea, weight loss, and loss in appetite or fatigue. There are some other treatment modalities can be used in treating the polycythemia rubra vera. And the picture showed a treatment guideline of treating this disease. And after diagnosis of the polycythemia rubra vera, venesection is used to maintain the desired red cell count. And if the patient is over 70 years old and an elderly, always suggest cell-reducing therapy with the hydroxyurea or other agent. Consider the aspirin. However, if they are under 70 years old, consider the history of clotting, the large spleen, frequent venesection, or platelet count higher than 400 million per mil. If it is positive, they will suggest to do the cell-reducing therapy with hydroxyurea or interferon in the young patients. Consider aspirin. If the result is negative, they will suggest to do the venesection. The venesection is the injection of phlebotomy. As mentioned, the other treatment modalities include the low-dose aspirin, the use of hydroxyurea, which is a myelosuppressive therapy for the patients who require the cytoreductive therapy that is caused by massive splenomegaly, considered for patients over 50 years old. And in the past, some doctors will use radioisotope P32 to treat the disease as well. And in another case I found, which is a very rare case, and rarely, the hematopoietic tissues occurring within the spinal canal and can cause cord compression, which is a type of metastasis. So in treating the cord compression, we can use the single posterior field to treat the cord compression for the palliative treatment to reduce the symptoms and also prolong the life survival of the patient. The prescription of this treatment modality is similar to palliative treatment, which give 4 Gray per fraction at 95% isodose level, 5 fraction per week, and to 20 Gray and stop. And this is the reference page of my presentation, and this is the end of my case study presentation, and thank you very much. Thank you.